in contact with Kenya to resolve legal hurdles over the proposed Ebola quarantine facility. This comes as the Ministry of Health insists surveillance has been enhanced at all points of entry, further assuring the public that no Ebola case has been recorded in the country. But doctors under KMPDU are faulting the plan, demanding transparency and questioning Kenya's level of preparedness. Elizabeth Atieno reports.
A day after the High Court of Kenya temporarily halted the establishment of an Ebola quarantine facility in Laikipia County for foreign nationals, the U.S. government says it is in touch with Kenyan authorities and are optimistic that the two countries can resolve the objections. In a rejoinder, Health Cabinet Secretary Aden Duale has maintained the government will proceed with the establishment of the Ebola quarantine facility to enhance surveillance, diagnostic capacity and emergency preparedness. CS Duale further says the government has established several dedicated isolation and treatment facilities, including specialized units at Kenyatta National Hospital, the Kenya National Police Hospital, and Moi Teaching and Referral Hospital, and additional sites have been identified in more than 10 risk border counties to ensure a rapid and coordinated response should a case be detected. Even before dust settles on the matter, youth leaders from Laikipia County have given the government a 48-hour ultimatum to halt the establishment of the Ebola quarantine facility, failure to which they will hold demonstrations.
If they don't ban that establishment, we are going back to the streets.
And the US being the first world country, they have all the expertise and all the capability and the resources to curb or to address the issue of Ebola. So bringing their citizens who are infected with the Ebola to Kenya, that is risking our lives.
The facility should not be set up in any part of this country.
Serikali kwanza iende mahali na ambapo ni muhimu, kama ni kule katika mpaka wa Uganda na Kenya, kuwe na facilities kama hizo, lakini sio na nyuki, tumekataa.
On the other hand, the Kenya Medical Practitioners, Pharmacists and Dentists Union has called on the government to be transparent with the details of the proposed Ebola quarantine facility, further questioning the country's level of preparedness in Ebola prevention.
And we ask the government to give out and to be transparent on the arrangements or these particular discussions that they've had with the US government regarding this particular agreement.
At the Jomo Kenyatta International Airport, screening has been enhanced. The border management team domiciled at the airport has increased surveillance at the 6 international arrival gates, with gate number 16 now designated for passengers coming from high-risk countries.
If we find that somebody is unwell on board an aircraft, we are notified by the aircraft. Once the port health officers are notified, they come and pick the passenger.
To improve surveillance quality, Port Health has enhanced genomic sequencing by collecting and testing waste samples from all planes arriving at the airport through national laboratories. The samples will be stored in a specialized fridge at the Port Health Clinic. So far, 129 Ebola cases have been confirmed, 1,027 suspected cases, and 246 deaths have also been reported since 15th May 2026. Elizabeth Atieno, TV 47.